How much sleep does a newborn really need? Here are 9 things every Canadian parent should know. Is your baby sleeping almost all day, but waking up constantly throughout the night? Are there days when your baby sleeps so long that you wonder if you should wake them up to eat? On the other hand, are there days when they only take tiny naps, waking up and crying the moment you put them down? This leaves many parents across Canada asking themselves, how many hours of sleep per day is actually enough? Is it normal for them to wake up so often at night? Should I let my baby sleep through the night? When exactly should I wake them up for a feeding? And how can I help them sleep better while making sure they stay safe according to our national health guidelines? Sleep is absolutely vital for a newborn's brain, physical growth, and nervous system. However, infant sleep is completely different from adult sleep. Newborns usually cannot tell the difference between day and night yet. They might sleep deeply during the day, but stay wide awake, fussy, or hungry all night long. This does not mean you are doing anything wrong, or that your baby has a health problem. In most cases, this is just a natural stage of development. In this video, we will explore exactly how much sleep a newborn needs, why they wake up so often, how to spot sleep cues, and the essential rules for a safe sleep environment in Canada. Make sure to watch until the end, because we will also share the warning signs that indicate when sleeping too much or too little might be a medical concern. Part 1. How many hours do newborns sleep each day? In the first few weeks after birth, many babies sleep about 16 to 18 hours a day. However, the total amount of sleep can vary quite a bit from one baby to another. Some babies sleep more, while others sleep less. But as long as they are feeding well, gaining weight, and growing, it is usually fine. Parents should not focus too much on a specific number. It is more important to look at the big picture. Is your baby waking up to eat? Are they feeding actively and getting enough milk? Are they having enough wet diapers, gaining weight, and having periods of being alert? Newborns do not sleep for many hours at a time like adults do. They usually sleep in stretches of 1 to 3 hours before waking up to eat, get a diaper change, or be comforted. A newborn's stomach is very small, so they need to eat frequently day and night. In the early days, some babies might even fall asleep while feeding. You may need to gently wake them or encourage them to keep nursing, as advised by your doctor or midwife. As your baby grows, their stomach can hold more milk, and their internal clock begins to develop, leading to longer stretches of sleep. But remember, every child develops at their own pace. Part 2. Why do newborns wake up so often? Adults go through several sleep cycles at night, but can usually fall back asleep without even realizing it. Newborns have shorter sleep cycles and are much easier to wake. When they shift from one cycle to the next, they might squirm, make noises, open their eyes, or cry. Hunger is the most common reason they wake up. During the first few months, waking up to eat is a basic biological need. Besides hunger, a baby might wake up because of a wet diaper, gas, feeling too hot or too cold, or loud noises. Many babies also have a strong startle reflex. When you put them down, they might suddenly jerk their arms, which can wake them up. This is a perfectly natural reflex in newborns. Frequent waking does not necessarily mean your milk supply is low or that your baby is sick. Look at their feeding habits, diaper count, weight gain, and how they act when they are awake. Point number 1. Newborns do not know the difference between day and night. Inside the womb, babies do not follow a typical day and night schedule. After birth, it takes time for their internal biological clock to develop. In the first few weeks, your baby might sleep soundly during the day, but be wide awake at midnight. This is very common, and it will not last forever. You can help your baby learn the difference between day and night. During the day, keep the curtains open to let in natural light. Talk to your baby, go about your normal household chores, and do not worry about keeping the house perfectly silent. When they are awake, engage with them through eye contact, gentle talking, and age-appropriate movement. At night, keep the lights low and your voice very quiet. When you change their diaper or feed them, avoid playing or making them too alert. You do not need to turn on every light in the room. A dim nightlight is usually better for nighttime care. Repeating this routine every day helps their biological clock stabilize. However, do not expect a newborn to sleep through the night immediately. This is a process that takes time. Point number 2. Learn to spot early sleep cues. Many parents wait until their baby is screaming before trying to put them to sleep. However, crying is actually a late sign of tiredness. When a baby is overtired, they can become overstimulated and even more difficult to soothe. Early signs of sleepiness include yawning, staring off into space, slow blinking, or avoiding eye contact. They might turn their face away from you, move less, or suddenly become very quiet. Some babies rub their eyes, pull at their ears, or start making fussy little noises. When you see these signs, it is time to dim the lights, reduce noise, and start your sleep routine. Every baby has different signals. By observing your baby closely, you will eventually recognize their unique cues. Putting a baby down when they are drowsy, but not yet overtired, is much easier than trying to calm a crying baby. Point number 3. Create a simple bedtime routine. Newborns do not need a strict schedule, but a predictable series of events can help them understand. A routine can be as simple as a diaper change, putting on pajamas, and lowering the lights. Then, you might feed them, burp them, give them a gentle cuddle, or sing a familiar song. You do not need a lot of steps. A simple, repeatable routine is often more effective than a complicated one. Try to avoid high-energy activities right before sleep. Avoid loud music or passing the baby around between many people. The goal is to create a sense of peace and predictability. If your baby does not fall asleep immediately after the routine, do not give up. Newborns need time to adjust. Be patient and gentle. Point number 4. Always place your baby on their back to sleep. Health Canada and Canadian pediatricians emphasize that every single time you put your baby down, they should be on their back. This applies to both naps and nighttime sleep. Never place your baby on their stomach or side, even if you think they sleep better that way. The side sleeping position is unstable, and a baby can easily roll onto their stomach. Some parents worry that a baby sleeping on their back might choke if they spit up. However, a healthy baby's body has natural reflexes to protect their airway. Unless a doctor tells you otherwise, do not use pillows or props to tilt the mattress for reflux. Sleeping on an incline can cause a baby's head to slump forward, which can block their breathing. Even when your baby starts rolling over on their own, always start them off on their back. If they roll over by themselves during sleep, and they can roll both ways, you do not need to flip them back as long as the sleep area is completely safe. Point number 5. Use a flat and firm sleep surface. Your baby should sleep on a flat, firm mattress that fits snugly inside a crib, cradle, or bassinet that meets Canadian safety standards. The mattress should only be covered by a tight, well-fitted sheet. Do not put pillows, thick blankets, stuffed animals, crib bumpers, or any soft objects in the sleep area. These items can cover a baby's face and interfere with their breathing. Adult beds, sofas, armchairs, and soft cushions are not safe places for a newborn to sleep. A baby can sink into a soft surface, get trapped in gaps, or roll into a dangerous position. Products like head-shaping pillows, sleep positioners, or inclined sleepers are not recommended. Just because a product is sold in stores does not mean it is safe for unsupervised sleep. If your baby falls asleep in a car seat, stroller, or bouncer, move them to a safe, flat surface as soon as possible. Car seats are designed for travel safety, not for long periods of sleep at home. Point number 6. Keep the sleep area cool and comfortable. Parents often worry about their baby being cold, especially during Canadian winters, and want to use extra blankets. However, Overheating is a significant risk. Babies generally only need one more layer of clothing than an adult would wear in the same room. You can check your baby's chest or back to see if they are too hot. A newborn's hands and feet might feel a bit cool, but that does not always mean they are cold. If their chest or neck feels hot, or if they are sweating or have damp hair, they are likely wearing too many layers. Do not put a hat on your baby while they are sleeping indoors, unless a doctor specifically tells you to. If you need to keep them warm, use sleep sacks or wearable blankets instead of loose blankets. These must fit correctly and not be able to slide up over the baby's face. Do not use weighted blankets or weighted sleep products for newborns. Point number 7. Room share, but do not bed share. The Public Health Agency of Canada recommends room sharing for at least the first 6 months. Having your baby's crib or bassinet in your room can make feeding and monitoring much easier. However, the baby should have their own separate sleep surface. Sleeping in the same bed with a newborn increases the risk of accidental suffocation or entrapment. The risk is even higher if the adult is extremely tired, has consumed alcohol, is taking medication that causes drowsiness, or smokes. Sofas and armchairs are especially dangerous if an adult falls asleep while holding a baby. The baby can slip into a gap or be pressed against the adult's body. If you bring your baby into your bed for a feeding, make sure to move all pillows and blankets away from them. Once the feeding is over and you are still awake, place them back in their own crib. If you feel yourself getting sleepy, put the baby back in their safe sleep space immediately. Point number 8. Do not try to force your baby to stay awake during the day. Some parents try to keep their newborn awake all day, hoping they will sleep better at night. This usually does not work and can actually backfire. An overtired newborn becomes fussy, has trouble feeding, and finds it even harder to fall asleep. Daytime naps are essential for your baby's development. Instead of preventing sleep, focus on helping them distinguish day from night through light and interaction. Keep the room bright during the day and keep your normal routine going. At night, keep it dark, quiet, and calm. You do not need to wake your baby up after every short nap just to make them tired for the evening. Whether you need to wake your baby to feed depends on their age, weight, and your doctor's advice. Point number 9. Do not compare your baby's sleep to others. You might hear about another baby who sleeps through the night at 2 months old. Meanwhile, your baby is still waking up every 2 or 3 hours. This does not mean your baby is a bad sleeper or that you are doing anything wrong. Every child has different needs, growth rates, and temperaments. Some babies adjust to their crib easily, while others need more time. Some babies eat a lot during the day and can go longer at night, while others still need frequent nighttime feedings. Focus on your own child's health rather than a set schedule from someone else. A healthy sleep pattern is one where the baby is feeding well, gaining weight, and is alert when awake. Never use medicine, herbs, or sleep aids to force a newborn to sleep longer. If you are worried, keep a log of their sleep, feedings, and diaper changes to discuss with your healthcare provider. Should I wake my newborn up to feed? In the first few days of life, many babies need to be woken up for frequent feedings. This is especially important if the baby has not yet regained their birth weight, was born prematurely, or has jaundice. Your doctor may instruct you not to let your baby sleep more than 3 or 4 hours between feedings. Once your baby is gaining weight well, and your healthcare team confirms they are developing normally, you might be allowed to let them sleep longer at night. However, this decision should be based on your specific baby's health. Do not assume that every newborn can sleep through the night without a feeding. To wake a baby gently, you can unswaddle them, change their diaper, or try skin-to-skin contact. You can also stroke their back or tickle their feet. Never shake a baby or use cold water to wake them up. If your baby consistently refuses to wake up for feedings or seems too weak to suck, call your doctor or 811 immediately. Should I swaddle my baby for sleep? Some babies feel more secure when swaddled because it mimics the feeling of being in the womb. However, swaddling must be done safely. Always place a swaddled baby on their back, on a flat, firm surface. The swaddle should not be too loose, as the fabric could cover the baby's face. It also should not be too tight around their chest, hips, and legs. Their legs should be able to bend and move naturally to prevent hip problems. Do not use weighted swaddles or weighted sleep sacks. Once your baby shows signs of trying to roll over, you must stop swaddling. A swaddled baby who rolls onto their stomach might not be able to use their arms to lift their head or change positions. If your baby does not like being swaddled, you do not have to do it. They can sleep perfectly safely in regular pajamas or a sleep sack. Should I let my baby sleep in a hammock? Hammocks might help some babies fall asleep because of the rocking motion. However, the curved surface can cause a baby's chin to drop toward their chest, which can block their airway. Hammocks are not flat or firm enough for safe, unsupervised sleep, according to Canadian safety standards. If you use gentle motion to soothe your baby, move them to a crib or bassinet once they fall asleep. No matter what product you use, your baby's face and head must always stay clear. Should I use white noise? Some Canadian families use white noise machines to mask sounds in the house. A steady, gentle sound can help some babies sleep. However, the machine should not be placed too close to the baby's head or the crib. The volume should be kept low and comfortable. Do not use extremely loud white noise for long periods. Also, you do not need to create a perfectly silent environment during the day. Letting your baby get used to normal household sounds can help them become less sensitive to noise. When is baby sleep a sign of a problem? It is normal for newborns to sleep a lot. However, they should still be able to wake up for feedings, react when touched, and have periods where they are awake and alert. Contact your doctor or visit an urgent care center if your baby suddenly starts sleeping much more than usual and is very difficult to wake up. Pay close attention if they cannot stay awake to feed, have a weak suck, or skip feedings. Lethargy combined with a fever, an unusually low body temperature, pale skin, deep jaundice, or unusual breathing needs to be checked right away. Another warning sign is if the baby seems limp, moves very little, or does not react to you, like they usually do. You should also seek help if your baby has trouble breathing, has blue lips, stops breathing, has a seizure, or cannot be woken up at all. Do not assume a non-responsive baby is just in a deep sleep. You know your baby better than anyone else. If you feel like something is wrong, trust your gut and seek medical attention. What can parents do when they are exhausted? Caring for a baby who wakes up many times a night can leave parents completely drained. Chronic sleep deprivation can affect your focus, your mood, and your ability to care for your baby safely. If possible, take turns with a partner or ask for support from family and friends. Try to rest when the baby sleeps instead of trying to finish every chore in the house. Do not hold your baby on a sofa or armchair if you are feeling drowsy. If you are extremely tired, place your baby on their back in their safe crib and take a few minutes to breathe. If you feel like you are losing control, put the baby in a safe place and ask for help immediately. Parents also need to look after their mental health. If you frequently feel sad, hopeless, panicked, or have thoughts of hurting yourself or your baby, please reach out to a healthcare professional or a local support line. Taking care of yourself is not selfish. A rested and supported parent is better equipped to keep their baby safe. In conclusion, newborns sleep a lot, but that sleep is broken up into many short stretches throughout the day and night. Waking up frequently to eat is completely normal and necessary in the early months. Do not try to force your baby to sleep through the night. Do not keep them awake all day, and do not compare them to other babies. Watch for their sleep cues, create a gentle routine, and help them slowly learn the difference between day and night. Every single time they sleep, place them on their back on a flat, firm, and separate surface. Keep the sleep area free of pillows, blankets, toys, and soft items. Never let your baby sleep unsupervised on a sofa, in an adult bed, or on an inclined surface. If your baby is lethargic, difficult to wake, refusing to eat, or acting unusual, contact your doctor. Newborn sleep can be exhausting and stressful for parents. But as your baby's nervous system and biological clock mature, those sleep stretches will naturally get longer and more consistent. What you need most during this time is patience, support from loved ones, and a truly safe sleep environment for your little one. If you found this video helpful, please give us a like, subscribe to our channel, and turn on notifications so you never miss our tips on safe newborn care in Canada. Share this video with other parents who might be struggling with a baby who wakes up all night. How long does your baby usually sleep in one stretch? Let us know in the comments so we can share experiences with other families. The information in this video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Every baby's sleep and feeding needs are unique. If your baby is hard to wake, feeding poorly, struggling to breathe, has a fever, or shows any signs of illness, contact your pediatrician, family doctor, or the nearest medical facility immediately.